Yeah. All right, so we're online. So it's about 7 o'clock straight up. Welcome everybody to our first Zoom webinar. We've all done a million Zoom calls lately, but this is the first one that we're doing through Young Medical Spa as information out to our patients. So there'll no doubt be a few bugs or kinks that we'll work and figure out as we go through. Some housekeeping thoughts. Use the chat box at the bottom, not the Q&A, but use the chat box at the bottom. I have Shelby on standby. She's going to monitor that as we go through. Make sure to keep your Zoom call on mute. At the end, we'll be talking about how to wrap it up by emailing Lesley at the end for that. So that's our housekeeping stuff. Use the chat box for questions. Stay on mute if you can. And at the end, I'll tell you how to consult with Lesley and how to email her to progress after the talk. Again, welcome to our first Zoom webinar. We're talking about CoolTone tonight. New technology from the people that brought you Coolsculpting. Young Medical Spa has a tradition over the last 15 years of bringing new technology to the Lehigh Valley and surrounding areas. We brought SmartLipo here, we brought Vaser here, we brought the Vampire Facial here, we just brought GainsWave here, the use of PRP here, and now we're proud to bring CoolTone to the Valley. It's been a couple years in the making for the CoolTone company. So now we're going to go start, and I hope, you know, in these crazy COVID times, I hope everybody's staying safe. It's just crazy times. Nobody's really faced this. I've never faced anything like this. And that's why the Zoom normally we'd have these events here in the office. But as everybody knows, with a mask and staying away in gatherings, it's better for us to do these events virtually. And even though there are some limitations virtually, we can usually get around those. All right, so moving on to our first slide. So again, welcome to our cool event, as I said, and we're gonna get toned. So the CoolTone, what is the CoolTone? The CoolTone is magnetic muscle stimulation that's going to make your muscles stronger and bigger. So the areas that we use the CoolTone on now are the abs, the glutes, and the front of the thighs. Now we haven't done the front of the thighs yet, so it's newer technology. We've had it out here for about 2 to 3 months. So we've done mostly the abs and the glutes here so far. And we anticipate that they're going to add more muscle groups to this, like the calves and the triceps and stuff shortly, but they have to go through the FDA and the slow process to do that. So the CoolTone can be helpful for people that want to augment what they're already seeing in their muscles. So when you talk about your abdomen, you want to have some definition in there already, be able to see the muscles. If there's too much covering the muscles, such as fatty tissue or loose muscles, you're not going to get the results with a CoolTone. You're going to get stronger, and you're going to get a bigger muscle under there. And sometimes there's benefits to having a stronger stomach, like the diastasis, which is the gap that women get in the muscles. That can get better. You just won't see that as much. So it's another dimension in the body contouring where we can add some of the muscle definition that exercise wouldn't have provided for people before. So again, muscle strength and tone, the abs, thighs, the glutes. We anticipate more muscle groups will be coming out that we can do, such as calves, triceps, biceps. Will be added shortly to the treatment regimen. We just can't do those now because we don't have enough experience with those right now for that. Okay, the treatment guidelines. Okay, so how often do you get treated? We're going to show you and describe a treatment by video. We pre-recorded a video of our lovely physician assistant, Judy Walls, to show you the treatment. We decided not to do a live demonstration because this was our first Zoom webinar, so we recorded the treatment and added it to this. So treatment guidelines. 4 to 6 treatments is the starting package. Most people start with a 4. Treatments are done once or twice a week. So it says twice a week on here. Sometimes that's difficult for people to get in. There's no difference in the response rates. It's just a little faster if you do it twice a week. But once or twice a week is once a week or twice a week regimen seems to do the same job. And of course, you have to keep your exercise regimen where it is. You have to keep your diet as good as you can be, even though we're all not perfect with our diet, especially during COVID times where we're all tend to be gaining some weight with this. So again, if anybody has any questions as we're going along, use the chat box at the bottom. So CoolTone, again, magnetic muscle stimulation. So it's a magnetic field similar to an MRI machine that's coming out, a magnetic field. The magnetic field goes down and makes the muscle contract. Now, if your brain tells the muscle to contract, it's working at about 20 or 30% of the muscle fibers will contract. When the CoolTone is on, it's 90% of the muscle fibers are contracting. So the magnet, like the MRI magnet, is stimulating a much greater degree of the muscles than even just your brain can do, or a sit-up or an exercise can do. And that's what allows this to do a better job oftentimes than the traditional exercise we would do. And that's who, CoolTone is for people that are exercising, are taking care of themselves, and want to see a little more definition in the muscle, which is different than with the buttocks. The buttocks, it's more firming and lifting. When that muscle gets bigger, it's a firming and lifting look. On the treatment day, you're going to come in. We always have forms. We always have lots of forms at Young Medical Spa. So you're going to come in. We're going to do pictures because the pictures are what we go by. We do your pictures, forms. We have to make sure that you don't have any contraindications, no pacemakers in there or any hidden metal in there. The applicators apply directly over the targeted area. I had my first treatment this afternoon. They put it right over top of my scrubs. And then when the treatment starts, it's a warm-up thing, and you're going to see that's a warm-up, and then muscle contractions, and then there's a tapping sensation. The cycle is designed to give maximal exercise. So you can't contract, go back for me. You can't contract for 30 minutes straight. The muscle wouldn't have time for recovery and stuff. So part of the proprietary stuff and how it works is how the machine cycles. Contraction and then rest, contraction and then rest. It's how it cycles. And a session is 30 minutes over there, and 2 applicators can be done, like each side of the abdomen, the 2 buttocks. That would all be 30 minutes because there's 2 applicators that can be running simultaneously. And I'm going to let Lesley talk a little bit about the before and after photos. I believe she's in some of them. And Lesley, you're still on mute. There
Hi guys.
Hello.
I'm excited to have you all with us to talk about CoolTone. We are really excited about this new treatment that we can offer. So we're going to look at some before and after photos, and then some of mine as well. And then we're going to watch a video of Judy getting the treatment done. So this is a good example of a patient who's a really good candidate for CoolTone. Patients who are at really an ideal weight with a really good BMI. So they don't have a lot of extra fat hanging around. Clearly this person already participates in some exercise. You see a little bit of muscle definition, but the CoolTone which is, 2 treatments a week is what we see here. That person had, great results in just 2 weeks time. It's good for men and women. As you can see, again, this patient already participating in some exercise, wanting to get a little bit more definition in the abdominal area, get a little bit stronger, be able to maybe do a bit more in the gym on his own. But those treatments of CoolTone, the 4 treatments, really provided a great result for that patient too. So, sorry, then the next patient here, again, another ideal candidate for CoolTone. Very little subcutaneous fat in the abdomen, but wanting to get a little bit more definition. And of course, this person had a great result. This is 10 days after their 4th CoolTone treatment. So that's something good to keep in mind, is that CoolTone, you get some pretty quick results that you can maintain with your own regular exercise. So it's not one of those things that's kind of not a permanent solution, I would say, but it's going to maintain that result as long as you're maintaining the exercise. So, and then I think we have another ad picture here with another gentleman. Again, you can see the greater definition, more of that 6-pack look that a lot of people who are working it in the gym are going for. And that's the best thing about CoolTone, is that it's not really gonna be a substitute for exercise, but it's a great augmentation and a good complement to what you're already doing in the gym. So there's some ab pictures, and I think we have some of the glute pictures here next. The thing that you should really notice about this patient here is the lifting of the butt. While the buttocks don't necessarily look that much larger, you can see some toning in the buttocks, and that what we call the banana roll, which is right underneath that little curve of the buttocks. You can see post her 4th CoolTone treatment that the buttocks look lifted and firmer and toner, which is what a lot of us are going for when we're working out those muscles in the gym. So, and again, that's just right after the 4th treatment. And then here's another patient too. A lot of women are looking for not only toning and firming, but a little bit more projection and a little bit more curve back there. And you can see this patient really got that result after their 4th CoolTone treatment. And this is immediately after. So that's one of the best things about CoolTone, is it's not something you have to wait a really long time to see the results for. It's something that is more of an immediate gratification, which if you're killing it in the gym, you know that the sooner you can see results, the more motivated you are and the better it's going to be. So, okay, so now we all get to look at my behind. So this is me. So we see a lot of pictures from companies who are selling their machines and how great they are. So we like to test it out on ourselves. So this is me. So as you can see, there's definitely some improvement. This is after my CoolTone treatment. We did some treatments on me. We did a series of 4 before the quarantine started. So this was before. I wanted a little bit more fullness, a little bit more firmness. And if you can take a look on my left butt cheek, it's a kind of flat there at the bottom. Yes, so Shelby's pointing that out. See how it's flat there? That's from sitting in the chair too long, not getting up, moving around. And then in the after photo, you can see it's really starting to curve there, and it's picking it up. I have a lot more volume on the top of my buttocks, and that's what's giving it that lifted appearance, is that increase in that glute muscle along the top. And then here's a good profile shot coming up next. So this is, you can really see the difference here, and you can imagine I'm thrilled with it. The profile really shows how strengthening those glute muscles gives the appearance of that lifted buttocks. Now, this was before the quarantine, and then, oh, Shelby, can we go back? Sorry. Okay, thanks. This is before the quarantine, and then this is my 5th treatment after quarantine. So I did, working out, lots of squats, lunges, hip thrusts, all those things during quarantine to try to do my best, but it really made a difference in the maintenance treatment. It still maintained that improvement even months later. So, and then I think the next one is my abdomen. So again, here, I'm a pretty good candidate for it. Don't have a lot of subcutaneous fat. So we did 4 CoolTone treatments on my abdomen. And one of the things that you notice in some of the other before and after photos, and for me as well, is that it really kind of shows off the oblique muscles too. So you're strengthening, it's not just in the front. That CoolTone treatment, you can feel it working all of the muscles of your abdomen during the treatment. So again, I'm really happy with that result. And then the next one shows another profile. So again, it's not something that's this huge, amazing transformation. It is subtle, but it does make a difference, especially when you're already doing all the right things. You're already, you know, working out and doing the best that you can. So, you know, these kinds of results are things that I would not be able to achieve on my own in just 2 weeks' time. So of course, I'm super happy with the way the CoolTone worked out. And I thought the treatment was easy. So I think next we're gonna have a video of Judy. A lot of you guys know Judy or have heard of Judy, or you've read great reviews about Judy. So she was also an excellent candidate for CoolTone. So this is what the CoolTone treatment looks like. So Denise is our Coolsculpting technician. She's the guru when it comes to all the Coolsculpting stuff. This is her getting the treatment started. So it's easy to select what area you're treating. This is her putting the applicator right directly onto Judy's abdomen. As Dr. Young said, we have 2 paddles that you can use simultaneously. Judy's a tiny person, so we just have one applicator over her abdomen. And you can see Denise feeling around the rib cage, so she knows exactly where to place the applicator to do the treatment on the abdominals. And we get you nice and comfy, propped up on a pillow. So she's gonna start the treatment, and you'll see her moving the intensity of the treatment. So when we first get started on your 30-minute treatment, we'll start at 0, and then we'll slowly increase the intensity of the treatment. Now, one thing that the people over at CoolTone told us was that you can get great results even at a lower intensity. You don't have to go 100%. Well, we tested the theory. I stayed at about 25 to 30% throughout the course of my treatments on the abdomen, and I got great results, as you can see. So Judy's the trooper. She went to 100%. So as you can see in the video now, you can see that Judy's abdomen is kind of tapping. That's the tapping part of the treatment, and it's kind of moving it, and there you see it contracting. So you can see from here where Judy's laying down, she's just relaxing, and you can see her abdomen moving. The contraction just feels like a strong contraction. Here you can hear it here, I think. I can't quite hear it, but that's the tapping. And what that's doing is it's increasing blood flow to the treatment area, and it's also decreasing lactic acid. So if you've ever had a really super hard workout and you're really sore, you have a delayed onset muscle soreness a few days later, that's the buildup of lactic acid. So this tapping is reducing that. So one of the great things I found after my treatments was that I maybe felt a tiny bit sore, but not really sore at all. So, which is a big plus after getting those super strong muscle contractions. And I think in the video here, we have Judy talk about what the experience felt like for her. So I think she's talking. Okay. All right. So Judy, I'm not sure if everybody could hear what she said, but she was talking about the tapping sensation and the muscle contraction and what that felt like. And she said it was maybe a 3 out of 10 when she was at the 100% intensity. So please let us know if you have any questions. I know Dr. Young's going to kind of wrap it up and talk to you about treatment packages and stuff, but I hope you guys will give it a try out. I'm super happy with it, and we're always happy to bring you the best treatments here at Young Medical Spa. So I look forward to seeing you guys.
We didn't have anything for Judy.
Sorry.
All right, good. Lesley, great job as always. Great job as always, Lesley. A couple of things that kind of came up that I thought you guys might want to know. So they've done studies after the magnetic muscle treatments to see how long they're maintained. And believe it or not, they got 6 months and 12-month studies to show that the butt lift and the definition has stayed. Of course, you have to do your exercise, but the changes have stayed for that. Nevertheless, people like to do maintenance. You know, every month, every 2 months, they like to do a maintenance treatment to help them stay even better. It's because the Coolsculpting is now part of the Allergan portfolio, which is also part of another bigger company, you get brilliant distinction points. I think that somebody told me it was 200 points a cycle. I think that's correct, which I think breaks down to 20 bucks a cycle. You get a coupon for that. A lot of people use their app for their brilliant distinctions, for their Botox and their Juvederm and some other treatments, and they get lots of real money, which is nice. So we could talk about pricing. So the normal pricing for CoolTone treatments is $2,000, and the maintenance treatments are $500. This is the normal pricing. As some of you may be familiar with Care Credit, it's a credit line that's used in medical offices, dental offices, and other facilities we can apply for, and you use it as like a credit card. And they have a variety of different payment plans and interest plans. We use it a lot here at Young Medical Spa. It really helps people out a lot for that. But of course, we have some specials for you. And remember, any questions, use the chat box down at the bottom for any questions. So the webinar special. So we're going to add a treatment. So instead of 4, we're going to do 5. You get a free maintenance treatment. And we're also going to take $100 off of the $2,000. So we got 5 treatments for the price of $1,900.
Just kidding.
So, because we tried to make it interesting, we wanted to make in the super special, super secret special just for tonight. Again, just trying to make things fun and lively. So my staff, against my better wishes, talked me into throwing in a 6th treatment for the price of $1,900. I didn't want to do it, but they said, you have to do it, Dr. Young. It's COVID, everything's crazy. Everybody's at home, everybody wants to get in shape. So 6 treatments for the price of $1,900. Normally, we would tell you had to buy it all right now to get the special, but again, this is our first Zoom webinar, so we didn't get that technical to be able to do that. Plus, we have to make sure before we sell you this treatment that it is right for you. So the way we're going to progress is we're going to have you email Lesley for anybody that wants to set up the consultation. She'll either bring you in or do a Zoom consult to look at your buttocks or your belly, just to make sure that you are appropriate for this, or the thighs. We don't want to sell you something that's not going to work. Now, maybe you need Coolsculpting first. There are people that need to do some Coolsculpting first to get a little bit out of the way. That's not hard. We see how many inches you can pinch, that kind of stuff, how much definition you already have. So the wrap up then for this will be to email Lesley at youngmedicalspa.com. I would encourage you to do that. Our phones have been crazy lately. We're still in the post-COVID, everybody was cooped up, and we're still getting lots of phone calls, but I would have you contact Lesley directly. Then she can just email back and forth with you to find the right time to actually talk to her for that. We're going to do the question and answers now for that. So we're flipping over to our Q&A slide. Again, use the chat box at the bottom. Does anybody have any questions for us that they want to share? I won't say who's sending me the question. I'll just repeat it back out to everybody so everybody can learn from it. When I need one question here, I'm going to feel like I'm not engaging everybody. Go ahead back to our all right, so we have a few questions coming in.
You're muted.
So we have a few questions coming in. So other than a consult, how much fat do you need to pinch to need CoolSculpt or the CoolTone? So you would want to pinch an inch or less, roughly, to not need the CoolSculpting. If you can pinch any more, then you might need the CoolSculpting. And the other thing is the visual. If you don't see much muscle definition to start with, that usually will correlate with that you might need the CoolSculpting first. So it's looking at it, it's visualizing like we do in body contouring all the time. We use our eyes and our hands to help with those answers. Can you work out the day of the treatment? Absolutely, no problems. Is there a rule of thumb with how to tell which is right? I guess you're talking about CoolSculpting or CoolTone with your question. How many treatments of CoolSculpting do you need if you go into the CoolSculpting first? So with a CoolSculpting consult, we always say that we're going to remove 25% of the fat layer with the treatment. So depending on how much we start with is whether people are going to do the 1, 2, and occasionally 3 rounds of the CoolSculpting, but 1 or 2 is the most common. Would you agree, Lesley?
Definitely. Yeah, most patients are happy with 1.
Most people are happy with 1. And then a lot of people come back later to give it a time. All right, hopefully I answered the question. Any more questions? Is the webinar recorded for later review?
Yes.
Yes, it is. As long as you're not going to hold anything I said against me. Other questions on the chat forum? Oh, one ended up in Q&A anyway. So this is not utilized for someone 30 pounds overweight. There's a question here in the Q&A. So for people that are too overweight, it just depends on how you carry the weight. So the 30 pounds is not the defining thing, the 20 pounds or 30. It's really where we want to reduce. So if we're talking, so for CoolTone, probably not. But for CoolSculpting, it just depends on where we want to treat and how you carry the weight. And that comes down to, again, our examination.
Can I say something quick too?
Absolutely.
So one thing to keep in mind too is that when we're talking about the abdomen, yeah, you definitely want to make sure that you have a low BMI. But on the glutes, a lot of women, we want to have some stuff back there. So I wouldn't worry too much, you know, if you're 15, 20 pounds, like Dr. Young said, if you're overweight, it depends on where you're carrying that weight. And just because you might be a little bit higher on a BMI scale, that doesn't mean that CoolTone can't lift and tone your booty. So just to keep that in mind for the glutes.
All right. All righty. Good. We got our question and answer. We got our chat room. All right. Anything else out there that people want to send across on the chat? If not, then we're going to say thank you once again for joining our first Zoom webinar out to our patients for CoolTone. It was very exciting. Great thank you to Lesley. Great thank you to Shelby in the back, Judy and Denise, all of us who helped with that. Again, follow up, email Lesley for your questions and then to set up the consultation with her. And with that, I think we'll sign off. Again, thank you very much. Stay safe in these COVID crazy times. COVID crazy times. Bye-bye.
Bye-bye.